Good morning. My name is Keisha Barr, and I am the Senior Director of Healthcare Innovation at Public Health Solutions. Unfortunately, Zach had a conflict today, and he's unable to join us. In my role, I provide oversight for our whole UNYC Community Resource Network, which essentially is the network that will also be managing the social care network. So I look forward to being able to work very closely with each of you and your organizations as our partners in this important effort over the next 3 years. One, thank you for taking time out of your busy schedules today to meet with us. Today's meeting is the first of many, and I don't know if you can see my face. I don't know if Relitza, if that's feasible or not.
Yes, I can pin you for everyone.
Okay.
We can.
Okay, great. Today's meeting is the first of many CBO stakeholder work groups that we will be conducting, likely monthly for the next several months while we collectively work together to stand up the social care networks. We recognize the important role that you, our community-based partners, will play in these social care networks, while also acknowledging that it's just not very efficient for us to try to have individual meetings with 200 plus organizations, and also that there is value in everyone hearing the same and consistent message. And so we will be using these stakeholder work groups to not only keep you informed of SCN implementation progress, but also allow you, our partners, who will be central to the success of the social care networks, the opportunity to inform decisions that are being made about how the network will function and operate. And so this meeting was scheduled a little late, apologies for that, but we will definitely prioritize getting future invites out timely going forward. Each of you on the call today, your organizations recently submitted applications to participate in our social care network as a community-based organization. If you are on this call today, it means that your application was cleared by our procurement team, who conducts an administrative review for accuracy and completeness, as well as our third-party risk team, who conducts a risk and compliance due diligence process. The next step in the process is contracting, in which our contracting and management team will be reaching out to your organizations and your contract signatory that was identified during the application process to essentially facilitate the process of getting your social care network participant agreements executed. I know that a few of you might have already executed agreements. Thank you. Others of you are probably reviewing the agreement and or awaiting outreach from our contracting and management team. So there is an assumption that at some point, most if not all of you on this call will eventually formalize the relationship between our organizations, Public Health Solutions as the social care network lead entity, and you as our community-based partners who will be participating in the network. In terms of today's agenda and how we will spend our time today, most, if not all of you are aware that the social care networks will be receiving, keyword here is will be, we haven't received it yet, funds from the state, an infrastructure grant from New York State to stand up the social care networks. And there is an expectation that these funds are also being used to support our community-based partners in building your knowledge and resource capacity to allow you to successfully and actively participate in the social care networks. We understand that some of your organizations may need to hire more staff to support the SCN or procure additional office space. And as CBOs participating in the network, there will be funds available to you to help support your capacity building. It is important to note that capacity building funds are only available to organizations that are participating in the network as a community-based organization. So that will require kind of one of the key dependencies there is that you have an executed CBO participant agreement with Public Health Solutions for the social care networks. In addition to providing financial resources to support your capacity building, we also understand that for some of your organizations, there's also a need or an interest in building your knowledge capacity in areas such as utilizing a standardized screening tool, which is a requirement from the state, and we'll talk a little bit more about that in future meetings, or considerations to make when engaging or screening certain populations that are prioritized under the waiver. And so in addition to providing you with financial resources to enhance your resource and service capacity, we also want to learn more from you about other perceived knowledge capacity gaps to ensure that we are doing our best to make those resources available to you to fill in any knowledge gaps that you might have to ensure your successful participation in the networks. And so Public Health Solutions has partnered with ICOR, an advisory company that will be working very closely with us and you over the next several months to help us better understand your capacity building needs, which will inform decisions the social care network governing body will make around how best to allocate funds towards capacity building, and also to learn more about other knowledge capacity resources to make available to you, i.e. trainings, to be able to support your participation in the social care network. ICOR has a wealth of experience working with organizations like Public Health Solutions in a similar capacity to, assess their capabilities and readiness to implement major public health initiatives. Recently, they played a very active role working with the state on the Medicaid unwinding process. They have access to a wealth of social, demographic, and cultural information and other qualitative data, which alongside your input will help us to learn more about some of the local needs and considerations to make as we engage them. And so ICOR will be supporting us in two main capacities, one of which we will spend much of our time today discussing. The first is, as I mentioned earlier, a CBO capabilities assessment in which they will be engaging many of you on this call to learn more about some of your knowledge and resource capacity building needs. And then two, they will be supporting us to establish a Medicaid member advisory council. We also acknowledge the importance of ensuring that our network is considering the input from those who will be impacted by the services that we will offer. And at some point, we will be establishing a Medicaid member advisory council to inform our network's operations and learning. We won't focus on two today. We will focus more on one, given the time sensitivity here and given the expectations of you as our community-based partners to support and inform this process, because you will play a major role in informing a lot of these decisions around capacity building funding, trainings that will be made available to you, technical assistance that we'll want to ensure is in place for you as network partners. We wanted to spend our time today preparing you for what's to come over the next few months as it pertains to capacity building and wanting to assess some of your capabilities. What is the approach that ICOR will take to conduct this assessment? How will you as our community-based partners be engaged throughout this process? What will it look like? What are the outputs? What is the timeline? And so in the interest of time, I will turn it over to ICOR to walk you through their approach, their plan, their timeline, how you will be engaged throughout this process. And then we can definitely allow some time at the end for questions that you might have as it pertains to this capabilities assessment or other questions around where we are in the SEN implementation process. Sounds like a plan. Any concerns about our agenda for today before I turn it over to ICOR? All right. Robin, I'm not quite sure if I'm turning it over to you, but I
You
will turn it over
are.
to our I-Core partners to get us started. Thank you.
Thank you, Keisha. Good morning, everyone. My name is Robin Reese, and I am a partner here at I-Core Strategies. We're really excited to be working with PHS and the whole UNYC network on this endeavor on the social care network. Keisha, thank you so much for that great level setting. Wanted to just reiterate, that we will be working with PHS and working with all of you to do this capabilities assessment. As Keisha pointed out, to really determine the capacity needs that you may have. And some of the things I want you to start thinking about now, because this is going to move fairly quickly over the next several weeks, is what do you all need for screening and navigating service provision? What's your current capacity, and what's your anticipated capacity to be able to meet the needs of the Medicaid members in your service areas? What are the HRSN services that you provide? Where, which boroughs, to whom? What are some of the gaps you may find in provision of services or in resources that you may need? What has gone well in the work that you all have done to date? What hasn't? That's going to be really important to understand, to Keisha's point, really to try to determine sort of what are the things that can be offered in terms of whether it's financial or knowledge capacity building, to be able to put you all in a position to be as successful as providers in the SCN. And how do you like to be engaged, right? What are some of the ways in which are most helpful for you to be able to be engaged both by PHS in your work that you're going to be doing for the state? So what I'm going to do, we're going to put up a presentation. My colleague Adisa is on. She's going to put that up. I'll walk you through this presentation to get into more detail around exactly what you can expect as we move forward. Tell you a little bit about I-Core, who the project team is, and talk a bit about the capabilities assessment directly. And then we'll talk about next steps with dates, and then Q&A. And Yadisa, can we put it in presentation mode? I think we're seeing presenter mode here. Thanks so much. As she's getting that slide up, I'll start just to give you a little bit of background about I-Core, and here's a slide that will come up. We are a New York-based firm, I-Core Strategies. We are based in Brooklyn. Our office is in Industry City. We are a Black-owned firm, and we have a staff that comes from a wide range of fields, and quite a number of our staff members actually come from a community-based organization, so we do understand the nuances of service provision across industries, and particularly we have practice areas in public sector, healthcare, strategic communications. Let's see, we'll get the slide up in a minute. You'll be able to see this. Yeah, I'm not sure. We're seeing this.
Click display settings.
Yep.
And then swap.
Thank you. Yeah. Just a moment. Thank you for bearing with us.
My apologies. One moment.
That's okay.
Will you be sharing the slides after the meeting?
So this entire recording is going to be put up on PHS's YouTube channel, so everyone will have access to it, and you can go through it again with audio or without if you want to see the slides. We thought it was the best way to share it, particularly for those organizations who may be unable to join the call. So everything will be available on the PHS YouTube channel. And I think, Keisha, you said usually within 48 hours it's up.
Yeah, we'll plan to get it posted no later than end of week.
Okay, fantastic. Thank you. Okay, thanks, Yadisa. Some of the relevant capabilities as a professional service firm that are most relevant to this work is our data and analytics that we provide, which is especially going to be relevant here for the capabilities assessment. We do community engagement work and local insight gathering, which we'll be doing with all of you, and then partnership development. And our role really, as Keisha pointed out, is to conduct capabilities assessment here, to understand what's working and what's not, what's needed for you and your work as part of the SCN. And then additionally to engage with the Medicaid members to be able to understand what their service needs are, and then to help establish this Medicaid member advisory board. we can go to the next slide. As part of this work, the members of the I-Core team, as you see here, those of us who work in engagement, we have our analytics colleagues here and then our research colleagues as well. All of us together will be working to assess the survey that's going to be given, to put the data together and put together some reports that we'll be giving to PHS. I do want to take a minute really quickly because two of my engagement colleagues are on here, Gina and Connie, and I'd like them to just say hello briefly so you can see their faces and hear their voices, because they will be instrumental in doing some of the virtual sessions that we'll be doing with some of you. And I'd just like to be able to allow them to say hello and introduce themselves. Gina?
Good morning, everyone. My name is Gina Ricard. I'll be the engagement lead, and my engagement colleagues and I will be leading group sessions and interviews to gain qualitative insights, and we look forward to seeing all of you in the weeks ahead.
Hi, everyone. My name's Connie, and I am part of the engagement team at I-Core. Happy to help support with all engagement initiatives for this project.
Thank you. All right, we can jump to the next slide, Risa. Thanks, Connie and Gina. So this is the key dates in the project plan, and we'll get into each of these a little more in more depth shortly. The first is the capabilities assessment, and that will be launched the week of October 7th, so not very long from now. That is going to be a digital survey that you will receive via email. We need one person from each organization will be the person responsible for completing it. And then the weeks between October 15th and November 1st, so about a 2-week period, we're going to be conducting 10 group interviews with about 5 to 6 people each. And these are going to be virtual sessions we'll do on Zoom. And this is when we'll be able to dive a little deeper than the survey is going to be able to get more qualitative insights that can supplement the survey responses. And we'll then flesh out that information, which will then go into a report. So as Keisha mentioned earlier, we're going to be putting together a comprehensive report with all of this data that will be given to the advisory, their governing board, so that they can then make the decisions about how to distribute the funds and figure out what to do on the knowledge capacity side. We also will be putting together a report for all of you. We think it's important anytime that surveys are done that those who participate get an output of what was learned, what was gleaned from that. And so we will be putting together a report for all of you, and that will come in December. All right, let's jump into the next slide and we'll talk specifically about the capabilities assessment. So as I mentioned, it is going to be a digital survey. We're using a platform called Question Pro. Each of you will get an email. It'll come from I-Core Strategies that will have a link for you to complete the survey. There will be an email address for contact in case you have any issues accessing the survey. We are asking that you complete it within a week. We're on a tight timeline here, so we really, really, really would appreciate your cooperation to try to get that survey done within the first 3 to 4 days that you receive it. And again, that's going to come out the week of October 7th. And then, so you'll have about 2 weeks to get it done. And then you also will be receiving an email asking for you to participate in the group sessions. As I said, it'll be about 50 participants. So we'll send you 10 dates when these will be held. Again, they'll be virtual. And we'll ask you to select some times that you're available. Understanding we know everyone is busy. And so, you know, our goal is to hopefully get 50 of you. We'll be able to do it in that 2-week time frame between the 15th and November 1st. And so we'll be on the lookout for those invitations. As I mentioned already, we're going to be doing a report for the governing board and then a report for all of you with the survey and the session and synthesis, really analyzing what we heard and bucketing and understanding what are the greatest needs that are more general across everyone. And then also the governing board, PHS, they're going to be using that to determine resource allocation and planning and implementation for the network. Some of the things to think about, and we'll get into this in the next slide more deeply, has already been mentioned, the technical assistance.
Can you add?
Oh, sorry. So knowledge and training is going to be important. What do you need to be able to do screening? Is it staffing? Is it physical space? Are there technology needs that you might have? Those will be the sort of broad topic areas that we'll be asking about in the capabilities assessment to make sure that PHS and whole UNYC have a good understanding of what it is that is needed. All right, can we go to the next slide? This is a lot of text on the slide. I'm not going to read everything, but again, you'll be able to look at this later. But really, what is really being sought from all of you is thinking about these additional categories. So we talked about current capacity already. Who are the populations that you serve? Are you serving in one borough, multiple boroughs? That information is going to be helpful as you think about service provision. Are you serving specific populations? Is that because your particular CBO has expertise in that area? Is it just that because of maybe where you are geographically, that tends to be the population that you serve? What are the services that you provide? Do you provide housing, nutrition, transportation, care management? Do you provide one of these, multiple of these? We'll want to dig into that in the survey as well. What are the gaps that you all have? How are you all servicing and finding your service delivery? Do you find things, can you note things that have been going particularly well in your work? Are there areas where there are gaps or places where you all could grow and do better with some additional resources? And then in your screening, are there methods of engagement that work particularly well with the populations that you serve? Are there areas that need additional support? And how best are you connecting with the Medicaid members that you serve? And what are the best ways for PHS to connect with you as well? We've talked about technology, care delivery, cultural competence includes linguistics as well, understanding that the various languages that your populations may speak that need to be thinking about translation services. Is that additional staffing? Is that additional translation support? And in compliance, technologically, do you have maybe messaging tools that are HIPAA compliant? Are there other compliance needs that need to be met and are required by the state that perhaps you need additional resources to make sure that you're able to do that? And here we just list a few of the special populations that are outlined by the state. There are obviously others, but we'll be diving into, again, do you all have specific expertise in these areas? Are these areas where additional knowledge capacity may be needed? All right, let's go to the next slide. So just a quick recap. Again, there's going to be a capabilities assessment. It will be digital. It'll be taken online. You'll get an email from us with a link, and then we'll ask you to complete it in a week. We'll do the group interviews, and then now I do want to make a quick note. We didn't talk about this. We're not going to get into a lot of detail, but I do want to note, because we will be assisting PHS with forming this Medicaid member advisory board, and we want to include their insights in the overall report that's going to the governing board, we are going to ask those of you on this call if you could assist us in reaching some Medicaid members that you all serve who might be interested or open to participating in group interviews that we'll do with them, and we'll do those on site in each borough. And then we're looking for folks who might be open to join the advisory board. Our first priority, just in terms of time, is to get the group interviews done. So we will be asking if there are some of you on this call who might be able to help connect us with some of the members that you all serve. And then the next slide, I believe, is next step. Again, we just can't reiterate this enough that we're on a very tight timeline. It's already September 19th. So in just about 2 weeks, you will be getting invitations to join the group interviews. The capabilities assessment will launch. Again, that is digital online. The group interviews will happen October 15th to November 1st. Those will be virtual. And so I just want to stop there. I know that was a lot of information. Somehow I see people already populate questions in the chat. I appreciate that. And we can, I don't know if it's easiest to start there, but just want to remind you all again, this is being recorded and you'll be able to see it later. We'll make sure that there is an opportunity. We'll have to figure out whose email address to give you, but to make sure that if you have questions after we're done with this call, you can reach out to us as well, or you can reach out via the PHS folks, and they can get back to us. I don't know if it's best, Keisha, to start with the questions in the chat or to ask.
Yeah, I think we can open it up for folks to ask. I mean, we have I-Core for limited time today, so I'd rather we start by prioritizing questions as it pertains to this capabilities assessment and the support that I-Core will be providing versus general questions around the SEN, just to make the best use of their time. So are there any questions that you have about the capabilities assessment? Feel free to come off mute and ask. And I'll try to get to others in the chat that might be specific to the assessment.
I have a question. This is Dan from Community Healthcare Network. Is part of the capabilities assessment going to be whether or not the organization has stood up a relationship with Unite Us or Find Help, or I don't know how you guys are approaching that technical piece?
Yeah, I mean, I think we'd like to understand your familiarity with the platform. Just to clarify, if you are participating in the organization as a CBO, you will be expected to utilize Unite Us. That is a requirement for participating as a CBO. And so, yeah, we will definitely like to understand whether you're utilizing the system today, your familiarity with the system, but there is also an assumption that, you know, every organization will have the ability to get trained on the system as a part of the onboarding process.
And just to follow through on that, is that part of the allocation? Like if there's a need to purchase that platform?
It will be free to you. CBOs,
Okay.
yeah,
You
will have access to it at no cost to you.
Great, thank you.
Hi, for us to determine capability, it also would be good to know the payment structure, because some of us may need to hire extra staff to meet the need. So, but no one talk about how payment gonna be. No one's talking about money now, and then it is important. I think I talk for all the CBOs here. It's important to know how much we're gonna get paid. No one is talking about.
Yeah, there is no predefined amount for an organization. There is kind of two buckets of funds that will be available to organizations. The first, as I mentioned, is an infrastructure grant that we will be receiving, have not received yet, which will support getting the network stood up. And we hope to be able to funnel as many of those funds to our community-based partners to support your ability to build your capacity to support the network. But as of now, like, there isn't a predefined amount that says organization A can get X amount of dollars and organization B can get X amount of dollars. This capacity building assessment will inform decisions that the social care network governing body will make around allocating funds out for capacity building, and then community-based organizations that were contracted with the network will have an opportunity to request funds to be able to build your capacity. There's a second bucket of money, which I don't want to go too far down this path yet, that will also be available for service provision. So services that you provide on behalf of the network, screening, navigation, or enhanced service provision will also be paid, assuming, you know, you're providing them to eligible members and meeting other requirements that might be in place for you to receive payment for those services. So this process that I-Core is working with will help to inform the resources that will be allocated in a big pool of money for our community-based partners to be able to request. But there isn't, as of now, a kind of predefined or a set amount that says this amount of money will go to organization B, this amount of money will go to organization C, if that makes sense.
Yeah, that makes sense. But my question is, I know you don't want to go there yet, but it's important because I know the government they expect everything to be rolling by March. X number of people has to be screened. But now, my question, like in terms of the payment structure, is it? I'm not saying like, oh, certain CBO get X amount of money. It's just like do you envision, or you probably know that already? Is it, let's say, $100 per to screen a client for X, social service?
Oh, you mean it? Yeah. So there will be a state approved fee schedule for the services that will be paid under the waiver. Unfortunately, that fee schedule has not been released publicly yet. Once it is released publicly, we will make it available to our network partners, but there will be specific payment points for services that will be reimbursable under the waiver, screening, navigation, and some of those enhanced service provisions.
Okay, thank you.
I have a follow-up question to build on that. So the agreement that we're supposed to sign now, we're signing that to be a member and to be participant. But if it turns out that we don't get the sufficient funds to build our capacity, or if the fee schedule doesn't make sense to support the services that we'd like to provide, then we can cancel that, then we can decline to be a participating member. Or I guess it's like we're signing the agreement now, not knowing
yeah,
what our funding
there's
will
some
be
information
to
that
go
we're still
forward.
awaiting from the state that kind of ideally would have already been publicized, that makes this a little bit more complex. I don't know if we have that's definitely a legal question. I don't know if we might have someone from our legal team on the call that could potentially answer that question. If not, I can definitely take it back for you, Julie, and try to get an answer for you.
Yeah, that's sort of been the crux of why we haven't
Yeah.
looked at, gone too deep in our contract yet. We don't know what
Yeah,
funds are going to
there
be
is a
given to
challenge
us.
that there's still some information that we are all awaiting from the state that I know for some of your organizations will inform, your decision around participating in the social care networks and the opportunities available to your organization. Once, it is available, we will definitely share it to our network partners. Just trying to see if we had legal on the line to potentially respond to that question. So Relitza, if you can capture that, we will definitely try to get a response offline, Julie, and get that back over to you.
Thank you.
And I don't think we have anyone from legal.
Okay. Any other questions about the capabilities assessment, kind of our objectives here, decisions that it will inform, how you will be engaged throughout the process?
Yeah, actually, this is Miguel McInnes from CTS. Will there be any detailed information regarding the total number of members, or for those of us who are in transportation, specifics around number of anticipated trips? Because I think those level of details are important for us to look at capacity. And
yeah, there's still some additional information, unfortunately, that's pending. So we know at a high level, I think when I did the math recently for Brooklyn, Queens, and Manhattan, we're talking about a little over 3 million Medicaid members.
Okay.
Might have changed, so don't hold me to that. And so there is an expectation from the state that all Medicaid members are at a minimum screen annually. And so that's kind of our starting number. However, under this waiver, the state has prioritized certain populations for those enhanced food, housing, transportation services. Unfortunately, we don't know which subset of that 3 million just yet will fall into that category. That is an exercise that, will also require some input from our managed care partners, who will be able to take the criteria that the state has said, which defines someone as eligible for these enhanced services, and bump it up against their enrollment rosters to say X number of members, from our plan would meet these eligibilities. And so we're unable to come up with some of those estimates now until we have a sense of what we're looking at as potential enhanced care population eligibility for those services.
Okay. And the second question is, for those that have not received outreach regarding the contract, is that still in process or in progress, or how will that?
Sorry, what was the question?
In terms of, you mentioned about CBO contracts, I know that you
Oh,
said...
yeah, our contracting and management team, and if they're on the line, feel free to chime in. I think they're in the process of outreaching to organizations who recently submitted their applications and their applications are cleared. I think there's probably still several that are still pending. I think we're just getting this process underway. So if you're on this call, you're on the list. And so you'll likely be receiving some outreach within, the next week or two.
And this is Barbara Silver from the CAMS team. Stephanie Janicki and Morelli Reyes, who are also on this call, are taking note of folks who are in the chat. And yeah, there are a number of agreements that are marked as priority going out today. So please stay tuned. And definitely follow up with us at PHS if you don't receive in the next few days.
Thank you so much.
And I do want to maybe clarify, I see a comment as a follow-up to Julie's comment around the agreement and not knowing services and how there will be reimbursed. It is also important to note that this is one of two agreements. The first agreement is just a participation agreement that you are, participating in the SCN and have agreed to meet those high-level requirements that we've identified in the agreement for participating as a CBO, utilizing our referral platform. There will be another agreement that is tied to money or funding, dollars exchanging hands. So anything that pertains to capacity building funds and or payments for services would be more applicable to the second agreement that is pending, which is why I was hoping to maybe get some legal input to better answer Julie's question, given that this one is more of a participation agreement. And there would be another agreement that would be associated to funding that would be provided by the network for service provision and or capacity building funds.
Yeah, and I'm just going to add to that again, this participant agreement is a no money agreement. There's no finite amount of funds associated with it. It's basically to just set up a relationship with PHS and organizations moving forward, and really particularly for this first step also, so ICOR has a sense of who to reach out to as well. So this first agreement, just to make it, thank you, Keisha, for clarifying that, is a $0 agreement. And then as we move through the phases with Keisha's team, there may be different types of agreements coming forward.
And then, Barbara, while we have you, there's a question that says, how do we contact the contract administration? I mean, I know they will be outreaching to you and will likely provide their contact information if there are questions.
Yeah, I'm trying to sort of manage the volume coming in. We have the list here of folks who are asking this question. We're noting that. And
I just wanted to add, we have sent a good deal of the participant agreements out. We do plan on sending, we're projecting by the close business tomorrow that we'll send a majority of the agreements out. And we hope that everyone will get their agreement by that time, and that's what we're shooting for, but there may be some on Monday. So please don't panic. And we have our portfolio manager for this initiative on the line, and Morelli, if you'll introduce yourself. She is the main contact.
Hello, Morelli Reyes here. Good morning.
And Morelli can put her email in the chat. She is the one who sent the original email that introduced us to you guys and talked about the capabilities assessment and needing one person, one individual to contact to basically provide a contact person for ICOR to start the capabilities assessment.
And just to follow up, and Stephanie, you didn't actually introduce yourself, so you want to...
Hi, I'm Stephanie Janicki. I am the Senior Director for General Contracts, and we're working very happily on this building this network, and I supervise Morelli and I report to Barbara.
And that blast email, again, hopefully you did receive was again asking for a singular point of contact within your organization who may be different from the person that does sign the agreement to be the person within your organization. These are again to cleared organizations within PHS to interact with ICOR on the survey because ICOR is asking for a singular point of contact within the organization. So as folks know, often the person who signs a legal document may not be the person, the programmatic person who will be interacting. So we have, you know, just keep that in mind. And I think that's all for now.
Yeah.
Yeah, Barbara, can I just jump in really quickly to that point? There's a question in the chat about whether or not individuals with multiple expertise across their organizations can engage in the survey. And to Barbara's point, we do need just one person to fill it out, but I do want to note it does have a save and continue function. So if there are parts of the survey that there are other individuals they need to consult with, they can stop where they are, get that information within that day, and then come back and complete the survey. So we just can't have multiple people responding from each organization. So, but do know that yes, there is a save and continue function, and then you can get the answers or information from other individuals at your organization, but we just need one person to fill it out. Just wanted to make that clarification. Thanks.
Thanks, Robin. I do see a few hands raised. Let's start with Jill Paklemba. Sorry, apologies if I didn't get your name correct.
Jill Paklemba from Samaritan Daytop Village. Just had a few clarifying questions. One is, I know you said it's going to be sent out, the capabilities assessment, the week of October 7th. Do you know exactly what the deadline is going to be yet? You said like about a week later.
I need to ask you to keep me honest. I think we said the 15th. Don't quote me on that. It'll be in the email when you receive it.
Okay, I just want to know how much time
we're going to have. A little more than a week.
Okay.
Slightly more than a week, but yeah.
Okay, great. And then there was on that same slide something about there being like group interviews or group meetings. Could you give us clarification on like who should be the person involved in that? I assume people overseeing the services, right?
So yes, for the group interviews, what we're looking to do in those group interviews is be able to get deeper responses or qualitative responses than the survey is going to allow. So once you all have completed the survey and as you start thinking about the different areas that were outlined, compliance, training, screening, service provision, your organization can, it doesn't necessarily have to be the same person who filled out the survey.
Okay.
If you all think that there's another person who's
just making sure we identify the right person who's going to be able to give you that kind of information. Okay, great. Then the other question we had was, is there a preferred screening tool for this?
Yeah, so there is a requirement from New York State that we will be utilizing the AHC screening tool. I'm not quite sure if you're familiar with it. I know some organizations, accountable health communities, I think that's the acronym, screening tool. Yeah, and it had some questions around food related needs, housing, transportation, and interpersonal violence questions. And so, yes, as a network, we will be required to utilize that screening tool, and it will be configured in the platform, and there will be opportunity to receive training on the tool as a part of the onboarding process as well.
Okay, great. And my last question is, if we're on this meeting, can we assume that our application has been approved and we're waiting for contracting?
Yeah, it's gone through the procurement administrative review, been cleared, and it's gone through the third-party risk and compliance due diligence, and it's been cleared. And it's, if you haven't received an outreach yet, it's in the queue for Barbara's and Stephanie's team to outreach to you.
Okay, so like if this email went to our CEO, he's likely to be the one that's going to receive that as well.
Yeah, I think on the application, there was a request to provide the name of maybe one or even two contract signatories. And so Barbara, Stephanie, can you confirm the emails that are going out to your team? Are they going directly to the contract signatories or the person that completed the application as well as the contract signatories?
The list that we received is comprised of the information we received from the application. So whoever was listed, the email addresses, the names.
But that was the contract signatory and a secondary signatory.
Yeah.
Can I ask a question, please?
Sorry,
Yes,
that response
sorry.
wasn't really clear. So because you got three names, there's the signatory, secondary signatory, and then the person who submitted the application. So I'm not clear on your answer. Who is the survey? Who is the contract going to come to?
The contract, and I put that in the chat, the contract itself will come from clm@healthsolutions.org. On Wednesday, the 11th of September at 4:40 p.m., a blast email was sent out from Mireli Reyes with information.
And just to clarify, Barbara, is it only going to the contract signatories? Are you also copying the person who completed the application on that email on the when it goes out?
I'm going to turn that over to Morelli and
Yes,
Stephanie to answer if
Yes,
there's a
thank you.
CC.
Thank you, Barbara. We received a list indicating primary signatory and secondary signatory from procurement, which is what we're using to address whoever is going to sign this agreement. We are using the list that was used during the application for like the emails that are going out, like with instructions and things like that. But the signatory, we have that information of that specific person will be signing, and they are the only ones that are receiving the document for signature.
So it sounds like, to answer the question, it's not being sent to that. There was also a third kind of email and name that was provided on the application. We requested the name of the person that was completing the application and their email address, the contract signatory, and the secondary contract signatory. It sounds like it's only going to two of the three. It's only going to the contract signatory and the secondary signatory if applicable. It is not being sent to the person who completed the application. All right, let's go to a couple of hands just to kind of ensure that we're trying to be as organized as possible. Zach Hall, I know you've had your hand up for a while. Are you there, Zach? Are you on mute?
Yeah, I am. Sorry about that. Thank you, Keisha. Just following up on a couple of questions related to the survey. Do you anticipate that the managed care organizations would share scale for eligible members for different services during the time we're submitting the survey, or?
I don't know. Like last conversation with them, if they haven't received the eligibility criteria yet from the state to be able to bump that up against their enrollment roster. So I'm not quite sure what the timeline of that will be and whether it will be available ideally, but yeah, not sure.
Gotcha. And then similarly for the fee schedule, do you think that'll be published before we submit answers to the surveys as well?
I don't know. Unfortunately, I don't know. I mean, I know that there's still some conversations taking place with CMS that has some dependencies on when they can release certain things.
Okay.
Hopefully, I mean, we have checkpoints with them, the SCNs, and you know, there are things that are on our short list that we prioritized as dependencies for our ability to be able to make decisions and stand up the network. And so hopefully that, you know, lights a fire under them in terms of making certain information available. But we unfortunately are at their mercy in terms of the timing around when some of this information is being made available.
Understood. Thanks for that. And just Robin, real quick, I found someone put it also in the chat, but if there's a way that we could also receive a PDF of the survey questions, I know the survey is save and progress, but I think it'd be helpful because there's lots of us who probably need to be involved at our organizations in forming good answers.
Okay, let me go back and talk to our folks who are putting the survey together and see if that's a possibility. And we'll get back to you guys through Keisha and let you know.
Perfect. Thanks.
Thanks, Zach. I think next is John Betts. You've had your hand raised.
Hi, thank you. Will the survey also be going to the signatories, or will the survey be going to the contact on the application?
I think
No.
it's the so you might have already received, and Barbara, Stephanie, keep me correct here. I think that was an email that might have gone out recently requesting the POC to the more programmatic
Correct.
POC for this capabilities assessment.
And that
If
would
you-
have gone to the signatories, or that would have gone to the
That was a more
contact?
expansive list, I believe, but if, if you want to put your email in the chat, again, that was sent on 9/11. Thank you.
Looks like Mara Harris is next. Mara, you have your hand raised.
Yeah, thanks. Can you guys hear me?
Yeah.
So I apologize if this is getting a little bit too in the weeds or too specific to services for the underserved. Happy to take offline, just tell me. But just wanted to clarify, I guess, really quickly, the difference between a CBO and a healthcare provider from the perspective of either PHS or from New York State, just because we have been operating under the assumption that we would be participating in this waiver with multiple SCNs as a CBO.
Yeah.
We were recently made aware that it's possible we should actually be participating as a healthcare provider because we already bill Medicaid. So I just want to make sure that we're, engaging in the
Yeah,
right
and
way.
Mara, I'm overdue to respond to your email. We actually took this back to the state, and we are advocating to the state to provide a little bit more clarity publicly around this, because there are some concerns that SCNs are interpreting this differently. From
Sure.
my perspective, your organization is a CBO and has the ability to participate in our network as a CBO. So as long as you meet the criteria that we've established and the requirements and sign the agreement.
Okay, great.
Clarity that we've gotten from the state just recently after you asked your question is their definition of a community-based organization is a nonprofit organization that provides services at the community level. And so then we asked the question of, okay, what does that mean if an organization that we consider to be a CBO also provides healthcare services? And they've stated very clearly that a community-based organizations can provide health or behavioral health services, so as long as that is not the only service that they provide, and there are other services like social related services that would justify them participating in the network as a CBO. And so for you specifically, I would consider your organization to be a CBO, and you providing health or behavioral health services is not an automatic disqualifier or excludes you from participating as a CBO. So as long as you're willing to meet the requirements that we've established and eventually sign a CBO participant agreement. This is an area where it's very clear, just based on feedback from our partners, that other SCNs are interpreting this differently and may even be using, you providing healthcare services as exclusion criteria to say you do not qualify as a CBO. And based on our recent conversations with the state, that is not how they define this. And so we are asking and advocating for them to provide a little bit more clarity publicly so that we're all consistent in how we're partnering with organizations, especially in New York City, knowing that many of you will likely be joining different networks.
Right. Okay, that's fantastic. Thank you so much, Keisha. I appreciate it.
Any other questions as it pertains to the capabilities assessment? What's next? Expectations of you?
Yeah, actually, just had one last question. In regards to the go live or start date for the program, we were told it was going to start October 1st.
Yeah, they've since shifted the timeline. Service delivery is now 1/1/24.
1/1/24?
Yeah.
All right,
I'm
great.
25, sorry.
Okay. Thank you so much.
Joel Berg, it looks like you've had your hand up for a while.
Yes. Is there any ability for us to influence the state as they determine the fee structure? Is there any sign-on letter? I assume the Department of Health is making this determination. For instance, our experience is it can take a good hour worth of staff time to pre-screen someone just for SNAP. Are they aware of how challenging this work is, and do we feel vaguely confident that their fee structure will vaguely reflect actual costs for this work?
We've definitely been advocating. I mean, we have seen a draft of it, but unfortunately we are under strict orders to not share it because it is a draft and changes are pending. And so we have been just even conversing with a couple of you on this call, you know, who are subject matter experts in some of these spaces to, you know, help inform our advocacy back to the state to ensure that the payment points on the fee schedule are sensible and, you know, adequate, may not cover the full cost of your services. And so, you know, where there is opportunity to do more of that, we welcome it. We've already been doing some of that. If you'd like to maybe have a discussion, Joel, with Zach or myself to, you know, advocate, we can definitely try to get your message back to the state. And I know we're not the only SCN that has been doing that as well.
Okay, great. Thank you.
Bonnie, looks like your hand is up.
Yeah, just related to the focus groups or the interviews with Medicaid members, there's a few questions wondering if there was going to be compensation included for those folks to participate both in the interviews as well as on the board.
Yeah, that's something we'll take back. I mean, I will say when we usually engage client populations, we do like to provide an incentive. So that's something that we'll discuss internally, but it makes sense and it kind of aligns to the approach that we've taken in the past when we are engaging clients and members. Loan from IDCC.
Yes, thank you. Just a question regarding the screening and the eligible provider doing the screening. Without consideration on capacity, has there been a determination as who would be available or eligible to do or conduct the screening?
I'm not quite sure I understand your question, but I mean, for us, anyone within the network will have, you know, can potentially screen. Community-based organizations to screen. The state has also stated that there is an expectation that, you know, managed care organizations could screen if they wanted to. Healthcare providers can screen if they want to. And so we will work with our partners on, you know, ensuring that we have, you know, some visibility into, you know, who within your organization will be a navigator or a screener on behalf of the network. And then there's also an expectation that we have established some minimum kind of criteria for our screeners and our navigators, whether it be trainings and other things that they will need to undertake before we can say that they are screening and navigating on behalf of the network. And this activity will actually help to inform some of that as well.
Thank you. Yes, the question, I'm sorry for not being clear, is who in the organization at the staff level would be eligible to do the screening. The difference in capacity building for us is whether we would utilize peers to do so, or whether it would have to go to target case management, which is a different sort of activity for us in outcomes. So just curious if there's guidance on who the eligible screener would be, and if that in terms how it would affect our capacity building towards it, if we have staff already within the area, or if it's going to be new hires we will have to leverage.
Oh yeah. Yeah, they're not going to be that restrictive, and we're also not going to be that restrictive in terms of saying specific roles within your organizations can only screen. That's the decision that you have the discretion to make. Kind of just knowing kind of the role of a screener and some of the requirements that the state will have around screening and navigating.
Thank you. That answers it very much. Thank you.
Rosemary, it looks like you have your hand raised, and I don't know how much longer
Yes,
we
thank
have
you.
ICOR before they need to drop.
Yeah, we actually do need to go. If
Okay.
if there's one last question, happy to take it. Otherwise, we can.
Sure. It's a question about the screening. Do we know if the screening result will be which services specifically, or would the screening just say whether or not the members are part of the tier 2 or populations?
So the screeners will help you identify specific needs, and then there will be some configuration in the system that based on those needs, it may recommend certain services for them for you to refer them to. And then before ICOR drops, any other capacity assessment or capabilities assessment related questions before they drop off the call? Alicia, I see that you have your hand raised.
Hi, I just had a quick question. So we are already doing that assessment through our EHR. We just recently were actually in implementation stage. Is there a way that the health exchange you guys are using would interface? Is there a way we could like batch upload information?
Potentially, but for our CBO partners, we are requiring that you use Unite Us. If there will be opportunities to participate in the network as a healthcare provider, and there will be an opportunity to establish more connectivity via the QE if you're participating as a healthcare provider, but for a CBO, you must utilize Unite Us for your transactions.
Okay, and it has to be directly entered into Unitas. There's not a way to like.
As of now, we're
connect
not
systems.
solutioning for that.
Okay, great. Thank you.
All right. So ICOR, Robin, team, thank you for joining us for the past hour. As we mentioned, stay tuned. You'll likely start to receive more communications from them and, you know, our contracting and management team and others as it pertains to the capabilities assessment. We still have about 30 minutes, so we can definitely answer any other non-capabilities assessment related questions that you might have as well, given that we still have a little bit of time remaining. Okay, I just got Lone, so let's try to get someone else first, and then I'll come back around to you if other hands are raised. If not, I can't see.
I see Sarah's
Okay.
hand raised. Sarah Ken.
Hi, good morning, everyone. I'm from Korean Community Services. I believe that all the activities related to outreach that are ultimately leading to successful screening, navigation, referrals, or direct enrollment. So I wonder regarding bill-level services, all the outreach activities will be included as a part of billing services, fee for services, or fee schedule. For example, number of hours by X number of staff members going to street for simple information or just one-on-one conversation with community members.
I don't want to incorrectly answer this question, so my initial advice would be for us to wait until the fee schedule is released. The kind of high level categories of payment points are screening, navigation, and then there are kind of these enhanced services around food, housing, transportation, and case management. There is the potential, but I'd have to look at, you know, what was shared, that maybe some of the more case management related services might have some outreach components to it. Don't quote me on that, but there isn't a specific payment point for outreach activities per se.
Thank you.
Relitza, maybe you can help me seeing who else has their hand up. I can't see the full list.
No worries. I think I saw Ray Barbieri next.
Thank you. Hi, everybody. Ray Barbieri, Kingsbridge Heights Community Center. Just sort of a broad question. Are all SCNs using the same systems? Are we going to have to do different ERMs for different SCNs? Oh God, please say no.
Unfortunately, no. We're not a fan of that, which is why we advocated for one SCN for New York City as a whole. I can say with 100% certainty that we're all on different systems. The 3 SCNs across the city are on different systems. It's not the ideal.
I think.
Can I ask a quick follow-up on that? Just do you know, like, Unite Us, Find Help? I don't know what Staten Island PPS is using, but like,
It's almost.
are there any conversations among them to like create interoperability?
Yeah, we've been, we've been meeting with, our partners regularly, and then we also meet with the other SCNs, and we are definitely, having discussions and are proponents of them, figuring out, how to establish some interoperability above and beyond the qualified entity HIE process that we will all be required to tap into. It's something that we continue to advocate for, especially in New York City, knowing that many of our partners might be participating in all three networks. So I know at least discussions are occurring amongst some of them, and it's something that we will continue to champion as SCNs as well. Like, especially given that, knowing that while the state has drawn these perfect regional boundaries, they especially do not exist in New York City. And there will be a need, and there is an expectation from the state that we are sharing information across the networks in an efficient manner, which will require some technology to be able to support that data sharing.
I think next I saw Lauren Espy.
Hi, thank you. Lauren Espy from Housing Works. Regarding the two sort of buckets of funds that you talked about, I know the infrastructure funds are to support the organizations and the ability to provide services. The second bucket that you mentioned, the service provision funds, is that the same as the fee schedule of services that are reimbursable through the waiver, or is there are those two different buckets?
Yeah, that's the same. The second bucket would be the funds to pay for services according to the not yet released fee schedule.
Okay, thank you.
Carrie Price.
Hi, good morning. I'm Carrie Price, Catholic Charities Community Services. Our clients are served by a number of different funding streams, including contracts with both the city and the state. I'm wondering if you have any information about whether or not one being served via an existing contract would preclude them from being screened, assessed, and served via the waiver.
The state has been very clear in that we can't, for lack of a better term, double dip. So if that client is, if you're providing those services for that client and it is being paid for elsewhere, you won't be able to be paid for those services under the waiver. And I don't know if your question is if the client, I don't know if I don't necessarily think it's at the client level, but more the service level. If that answers your question.
No, that's helpful. That's what we were hoping, that sort of other services might be covered via existing contracts, but these services could be covered via the waiver.
That
So
is
thank you.
my interpretation. I will confirm that to ensure that I'm not miscommunicating anything.
Okay, thank you so much.
Candia Richards.
Hi, good morning. Candia Richards-Clark from Housing Solutions of New York. My question was similar to the prior question, whether there was a requirement for staff on this SCN to be mutually exclusive to service delivery, and whether there's an understanding that we're leveraging dollars from other contracts.
I'm not quite sure what you mean by leveraging dollars from other contracts, but there's not an expectation that they're mutually exclusive, and that the staff that supporting the waiver isn't limited to only supporting waiver related activities.
Okay, great. That answers my question. Thank you.
I think I saw Asha next.
Hi, yes. I should have asked this when Icor was still here. I apologize. But I just wanted to clarify that the group interviews that will be taking place from October 15th to November 1st, is that engaging, are those interviews for Medicaid members, or will that be engaging our organization staff as well?
It's for community, for your organizations or community-based partners.
Okay, great. And so the Medicaid population that's like engaging them is going to take place at a separate time?
Correct.
Great, thanks.
Gary Carter.
Thanks a lot. So I'm assuming that the Unite Us and the Find Help platforms are public-facing, web-based platforms, right? So any one of us, it's just a matter of how to learn to use the system, right? But it's not anything that we have to configure into our data network or anything like that, right?
No, and just to clarify, we're using Unite Us, we're not using Find Help. But there's a URL that you could go to for Unite Us to access the system, but it doesn't require a configuration or, you know, being able to like configure it into any of your existing systems.
Okay, great. Thank you very much.
Loan with IDCC.
Thank you. I just have a question about participation. If you are CCBHC, which is under Medicaid, as a Medicaid program, can we still participate? It is not under the 1115 waiver.
I'm not quite sure I understand your question. You're an organization that's providing also currently billing Medicaid for certain services that you provide. If you qualify as a CBO organization and are willing to meet the requirements that we've defined for participating in a network as a CBO, and you sign a CBO participant agreement, you can participate in our network as a CBO, even if you as an organization might be providing other billable services to Medicaid. Now, there's that whole conversation around not double dipping, right? That comes into the equation that will need to be kind of a consideration for our partners that are billing Medicaid for other services, but that does not preclude you from being able to participate in our network or prevent you from being able to participate in our network.
Thank you.
Evan Howell.
You're on mute.
Apologies. Yeah.
Again. Okay. Can you hear me now?
Yeah.
Yes.
All right. So I'm Kevin Howell from Cabs Network. I have a question in regards to, so I know with the screening, we will be able to do that within the baseline screening. What is the allowance for further screening on clients that identify as needing nutrition services or transportation services or whichever of the services? Will there be capacity to do additional screening triggered from the initial screening that is made through the baseline screening tool?
So there is a requirement from the state that every Medicaid member is screened at least once annually, and that would be the only screening that would be reimbursable. However, if that member has a qualifying life event over the course of the year, that the state will allow for that member to be rescreened and that payment to be reimbursable. So there's the screenings that you will get paid for, there are definitely some requirements around that, but it doesn't limit, you know, you from being able to screen. It's just what will and will not be paid under the waiver. There are some specific requirements for that, if that answers your question, which currently is one screening per year per Medicaid member, unless there is a qualifying life event, like someone gets pregnant or, you know, or someone maybe moves, that would qualify them to be rescreened. And that additional screening would thus be reimbursable, if that answers your question.
So, I mean, so you have the screening, but then you have navigation services, right?
Yeah.
So within the context of navigation services, those are usually going behind, okay, now that you say you need nutrition, I'm going to help you to find the right nutrition partner. For me to determine what nutrition partner makes sense to you, I got to now figure out another screening on top of that initial
So
screening.
they're calling that eligibility verification.
Yeah,
so
it's not eligibility. Right. It's
so
more
there's the initial
service
screening,
management.
which is the screening that will be utilizing the AHC tool that is kind of what will be used to say that this Medicaid member has been screened and we will pay for this. And then once you've screened, you've identified needs, then there's kind of an eligibility verification process that kicks in to confirm whether that member might be eligible to navigate to some of these services that will be reimbursable, or whether you should navigate them to what they're calling the existing local services infrastructure. That navigation is also a separate payment point from the screening. So you could be potentially reimbursed for the navigation to services as well. And then there are certain services that will also be I don't want to say reimbursed, because technically you're not being reimbursed, but will be payment points on the fee schedule as well, if that answers your question.
No, that answered that question. And my last question, and we will take this off air, is just to kind of then connect. So we move from the eligibility screening, baseline screening, and then we move into navigation services.
Yeah.
Will we be able to document that navigation screening within Unite Us, and we will be able to manage that entire process in Unite Us?
Yes.
Yeah.
Okay. All right.
Okay, and I'm looking at the clock. We'll take maybe 1 or 2 additional questions and start to wrap up and kind of discuss next steps.
Great. Mara Harris.
Hi, Keisha again. So I really don't want to beat this issue too much, but just on the double dipping question, just one last thing. Just so that I'm very, very clear, we have services that bill Medicaid and services that do not, both of which are potentially eligible to be concluded as a level 2 HRSN service and be reimbursed by the waiver. Just to give one example, in our CCBHC, which of course does bill Medicaid, right, there is already screening and navigation being done regularly, right? If we employ staff in that CCBHC to do those services that, sort of categorically fall under the waiver services, those would not be eligible for waiver reimbursement because they're already being reimbursed via CCBHC Medicaid dollars. Is that correct?
Those services?
Yes.
Yeah, I mean, if they're already being reimbursed via other funding mechanisms, then they would not be reimbursed. Those exact services would not be reimbursable under the waiver, if I'm interpreting your question correctly. And given, I don't want to misspeak around some of this,
Sure.
what I will probably do is kind of thinking about just the agenda for next month's meeting. This may need to be a topic. I wanted to cover some, high levels around kind of the care delivery process during our next meeting. And this might be a good topic to try to carve out some of the agenda to focus on as well, just given the number of questions around it today. So let me take this one offline and ensure that I'm not miscommunicating anything.
Sure.
And that we have some clear guidance from the state around this, and then perhaps we can dedicate maybe 10 minutes or 15 minutes of next month's agenda touching on this with our partners, given that I know for many of your organizations this will be important, given services that you provide today that are already reimbursed via other government funding sources.
Awesome. Okay, yeah, that'd be great. Thank you so much.
Maybe 1 or 2 more questions and then we'll plan to wrap up.
Okay, Bonnie Mohan.
Hi, wondering how you're envisioning like referrals into screening coming. Like, will CBOs mostly be doing in-reach within their current kind of client base, or getting referrals from MCOs to do screening? How do you see that going?
This is something I think we want to be able to, flesh out, working closely with you, our partners. Our preference would be more of the former. We're not a fan of just taking lists of people and doing kind of mass outreach, and we're not trying to turn the network and our partners into call centers. And so we want to be able to kind of tap into some of your outreach and engagement kind of pathways and mechanisms that you have in place today to be able to identify folks to screen. So we would definitely like to learn a little bit more and flesh this out in collaboration with our partners. But our going in assumption is that we would love to minimize just getting lists from an MCO or a provider or someone in doing outreach, but rather tapping into the workflows and kind of the grassroots, processes that you have in place today to be able to identify and engage these members. Which is why we want as many of our CBO partners as possible to, support screening and navigation on behalf of the network, so that it doesn't kind of turn us into a call center or turn you into a call center to just do these proactive outreach to members.
And Keisha, I think I see one last hand raised if we have time to answer. From Anna Kaganova.
Hello. I just wanted to clarify, and I'm sorry if this was discussed before, but you mentioned this will not be that the cost structure or the sort of the payments for the services provided will not be given out on a reimbursement basis. So on what basis would it be given out on?
Well, I don't like using the word reimbursement because technically you're not necessarily being reimbursed for your costs. There's a fee schedule that will define how much you will be paid for a screening or how much you can get paid for navigating a member to a certain service or how much you can get paid for providing a food box or, providing a home delivered meal. And so payments for those services will be in accordance with the fee schedule, which is what I meant by that.
I see. So after we provide a service, we would be just paid for it. Right.
Yeah, if you provide an eligible service to an eligible member and it is a service that can be reimbursed, you will be paid for that service in accordance with what the payment point is on the state approved fee schedule for that service as a part of the social care network.
Understood. And will there be there will be, based on our contracts, there will be a limit, a cap on how much an organization can
yeah, we still need to think through that, and I don't want to misspeak. There are definitely some limits on what a specific member can receive over a given year, like how many food boxes they can get or how long they can receive a service, and that will definitely be factored into the equation. Anything above and beyond that, I'm not really qualified to speak to that, and I'd rather not say just yet.
Okay, sounds good. Thank you very much.
Okay, well, this was a lot of good questions. Hopefully at least having ICOR on, given that I know this is one of the initial activities that we will be rolling out that impacts you as our community-based partners. Hopefully having ICOR on provided a little bit more clarity for you around what to expect over the upcoming weeks as we, working collaboratively with ICOR, start to engage you to better understand some of your capacity building needs. As I mentioned, the goal will be for us to have these monthly so that we can answer some of these questions that you have, but also use this as a means of keeping you informed and allowing you, our partners, to inform some of our implementation planning decisions. So we will work to get the invite for the October meeting out maybe within the next few days, and then start to think through the agenda for that meeting and ensure that we get that out to you in advance of the meeting as well. High level, the state has laid out at a high level what they're defining as the care delivery process. And so it might not be a bad idea, especially for many of your organizations who would be screening and navigating and providing services on behalf of the network, to get a sense of the high level end-to-end process and some of the requirements that the state has defined for how we go about executing that process. So that might be a good candidate for next month's agenda, in addition to just ensuring that we have answers to some of the questions that you were asking today. So one, thank you for your support. Thank you for your interest in participating in the network, and thank you for your insights and your inputs. And we will definitely do our best to ensure that, you know, we are keeping you up to date, keeping you engaged. And once information is made available from the state, and once we know more, we will definitely do our best to ensure that we're funneling that information out to you as our community-based partners as well. So if there are no more urgent questions, I think we are good for today.
I want to, Keisha, is it okay if I just jump in about the provider work group next week?
Yeah, sure.
Hi, everyone. My name is Julia Keegan. I may not have met all of you, but I certainly have met some of you from our capacity building team's work. I know some of you have been invited. Those are who are healthcare providers have been invited to our provider work group, which is next Friday, the 27th from 2 to 3:30. Very similar forum to this to answer questions specifically relating to healthcare providers in the network. So if you are a healthcare provider and you haven't received that invite, please reach out to somebody at PHS. I'll put my email in the chat. We would love to have you there as well, so you can ask questions that pertain specific to your needs as a healthcare provider, and so that we can get your input as well as we continue to plan for this initiative. So I've taken note of folks who have introduced themselves in the chat. I will send out more invites today, but please, if you don't have that on your calendar, reach out to us.
And Julia, that there was some ambiguity around who's considered a healthcare provider and who's considered a CBO. So I'm here in this meeting at the CBO, but one could also interpret me as a healthcare provider. But I didn't receive that invitation.
I think Keisha,
can you also clarify if healthcare provider includes behavioral health, such as substance?
Yes. If you're a behavioral health provider, please do join our meeting. You are considered a provider, a healthcare provider under the umbrella of the SCN. Keisha, please correct me if I'm wrong here, but you're welcome to join the provider work group if you are a part of the CBO work group.
If you provide health or behavioral health services.
Correct. So if you are being considered a CBO, if you've submitted an application as a CBO, obviously you have, because you're all here, and you also offer healthcare services, primary care, behavioral health. We're inviting IPAs, health homes. Please join us on Friday next week. And we're in the process of working through this as well and figuring out the best forums to have different organizations join us. And we'll definitely be curating these groups as the months go on.
And who do we contact if we haven't gotten that invitation?
Sharon, you should definitely be on the list. So I'll confirm that you get on there if you're not on there.
Go ahead.
Catholic Guardian Services has not also received any invitation for that.
Okay, thank you so much. If you would like to be invited, you can put your email in the chat. Otherwise, I've just put my email in the chat and you can reach out to me. At this point, please reach out to anybody that you're in contact with at PHS and we'll get folks involved. Thanks for your patience, everyone.
Thanks, Julia, and thanks for your input today and your insight. This was very helpful as we continue to kind of get these networks set up. So we will chat, many of you, we will chat again next month. Thank you
so much.
I can't do it because fucking shutting down.
Julia, I'm noting everyone in the chat who's asking to be included in a healthcare provider group, FYI, but I'll download the chat as well and share that too.
Great. We'll
Yeah.
definitely send that out today.
Okay.
Thank you.
Thank you, everyone.
Thank you.
Gary, I wrote your name down. If you could
Okay.
tell me your email, that would be great too.
Yeah, I just put it in the chat.
Oh, perfect. I just haven't gone there. Thank you.
Thanks a lot.
Thanks, Gary.
Really, I almost have all of them.
Okay, I'm also taking them down too.
Okay, great. Yeah.
Are we still recording, Relitza?
Actually, I'll stop the recording now. Thank you.